Happy to be here.
Very good. So you hear us, we hear you. So let's start by asking the same question for all the panelists. Maybe we can start with you, Janine. So what do you think are the main barriers for implementing healthcare technology in pediatric settings?
Oh, I could talk about this for a very long time.
Yeah.
So I will speak specifically from the US context, but I know that has a lot of downstream implications. And I only minorly touched on this. I think you're right on nailing the nail right on the head when you talk about what's the implementation issues. I think that there's need issues where people ask much smaller questions in a smaller population with a smaller impact, and that doesn't work in pediatrics. You have to ask questions that have a bigger impact, that truly are able to drive a field forward. So it starts there. But on the implementation side, we have a very broken healthcare system in the US, which of course I know trickles down everywhere else. And we're often jealous of other people's healthcare systems, such as yours. However, there's something that always goes through that. So we don't have a healthcare system that is set up that rewards preventive care, that rewards healthy life, that rewards any of that. So I think the biggest problem right now is that children don't vote, but older individuals do. And so that drives everything from there. It drives reimbursement. When people talk to you about reimbursement, they say, oh, we'll just get the Medicare code. Well, if you know about the US healthcare system, Medicare is only for people above age 65 and some very specific conditions. Well, no pregnant mother or child is above 65. So that leaves you in this very weird area of how do you get reimbursed? Where do these things fall? 50% of children are under Medicaid, which is our government-based insurance, which reimburses at 50% the rate of Medicare, the older people insurance, which is a real problem. And so there's policy changes that need to occur. And, my team and many, many others are working to make those policy changes. But that's probably the hardest part when it comes to implementation, is truly that there's structural things in place that don't allow you to be able to implement and understand the implementation process in a way that's interesting. I will give a caveat, because I always like to be a realist about this too, and give a little bit of optimism. The really good part about it, though, is you don't just capture a small part of the market. If you're a solution in pediatrics and there's nothing else out there and nobody else has FDA approval or no one else has any sort of clearance, then you can actually capture the entire market, which leads to a much larger market penetration. And the numbers are, there is reimbursement there for that. And there's a lot less children's hospitals, and they tend to work together better than adult hospitals, and pediatric providers tend to be more engaged. So I do think that there's a lot to be hopeful for, even though there are a lot of challenges.
Thank you. And maybe Sakari, I know that you have to leave in a few minutes, so maybe you can tell a little bit about the challenges you have seen.
Maybe for me, I think the most important, as an engineer, biomedical engineer as a background, I tend to look at things quite direct. And of course, it's the regulatory aspect of doing and the higher needs for kind of ethics committee and the stricter ethics committee are also something you have to keep in the mind. Actually, the other side of things is basically the doctors in pediatric side are more connected, especially in the subgroups like heart surgery. They are all connected with each other. So if you make an innovation in the space, it's pretty much you go to few meetings and you have the full globe. All the professionals know about your invention. So in that side, it can be better, but also in the kind of the regulatory aspect is, I think for me, is the kind of biggest limitation in that kind of access in the market.
We can help you with that one in the US if you want.
That would be great. Great. He will contact you later. Yeah. Good. Okay, Mikko, would you have something to say about what have been the kind of like challenges you have seen in your project in this kind of like population of the mothers?
Yeah, I mean the population has been really great. They have been all very enthusiastic about our research. I think the challenges have emerged other places. The joint development with the companies required quite a lot of work to get things started, contract and that kind of things. And now at this stage where we aim to pilot this in maternity clinics, the financial situation is really the challenge, really the biggest challenge, that we would need money to implement the pilots, and that's challenging currently.
I'd say matching the how would I say, the user and the payer, or the problem and the beneficiary. Because in our case, for example, what I'm talking about, I'm not talking about pediatrics, although we have an impact on the baby being born, but I'm talking about maternity care, and that is that the mothers and the couples themselves are very willing to invest in their well-being and health, but it's still, since the biggest beneficiary of dealing with the problem is the society, and we should find sort of a bigger player there to pay for these solutions. But that would require us to have the right measurements and right indicators in place. And going back to the first comment again, that we are not equipped yet for preventative care, and we don't have the measurements where we can sort of measure not developing an illness. And this is the major problem, I think, when you're actually trying to create something that is truly preventative. That how do you prove it, and how do you show it? And this is where I'm super excited about finding something like cesarean section, which is very binary, which is very, you either have one or you don't. And that's if you can show something like that, even though it's not directly towards what we are doing towards improving the maternal mental health, it's still part of the journey, and that is something that everybody can understand. So finding those indicators and finding the right things to measure, I think, is a key to finding a viable business and finding a viable solution.
Thank you very much. I think Sakari, are you still ready for one more question? Okay, good. So let's Sakari, you can start the next one. So how do you think you balance that kind of like innovation and also then giving like affordable, equal like access to healthcare? Because you would think that you innovate something new, it will be quite cost prohibitive. So how do you make it sure that like you can innovate but still keep it like accessible?
I think that's the kind of main focus of engineering, in a way, that when you develop a solution, at least for me, the biggest focus has always been to do something which works, and then after that you start thinking that how I can administer this in the most cost-effective manner. But of course, the first has to be that I want to make something which works, and then you start figure out what is the best way to give this type of treatment. And like in the before, we said that in a prevention. Actually, that now that I think about the last question, is that actually the issue is not. It's actually in the prevention, that we don't focus in prevention. We focus in treatment. And children, they pretty much are healthy, and then they might get some issues we want to prevent. And kind of the aspect of, if you want to focus in prevention, usually the money is not there initially, so you then need to kind of, usually people might in the start have to pay from out of the pocket themselves from the preventative solutions. So if you focus in that space, then you have to be really careful how you accumulate cost into your approach and solution you're going to offer to the customers. And I think the digital solutions are quite nice in a way that they don't have any, the bill of material is quite cheap for giving the treatment. So then I think those are excellent preventative solutions you can offer.
And maybe Mikko, you would like to continue on that?
Yeah, in our case, the we didn't focus on preventive care in the sense that it's very important. There are preventive actions that avoid the incidence of gestational diabetes, and there are some very effective interventions on that. But on the other hand, there are still going to be people who will actually have the TDM diagnosis. So it's very important to treat that as good as we can.
Yeah, I want to second the first one, that the money is not there, and then we have to first have the users to pay for it before we can actually show that there is an impact. And then going to what you said about GDM, about gestational diabetes, as a sort of like considering that as an end outcome. But I would consider that sort of like, since we're having, I don't even dare to say out loud how big a proportion of the parturient women are actually diagnosed with gestational diabetes with the current criteria. But I think that's just the beginning. That's when we start actually, if we can improve the treatment, that's already prevention, because we're preventing the secondary sort of problems and outcomes from there, part of which are actually mental health problems. So it's kind of, I think also there's a lot of synergy with what we do. And I think that we should sort of think that it's not just one outcome that we need to focus on, and see the whole bigger picture, and also how you, Sakari, mentioned that the infections are also contributing to gestational diabetes. And so it's kind of like having that holistic view and seeing the problems not in silos.
What about you, Janine? What do you think about how you balance this innovative new products with kind of this accessibility reasons?
Yeah, I think I might flip that on its head from a little bit of what was said before. I definitely agree, but I would actually think about it early on. So work that we've been trying to do around health equity and other things, making sure that we really address all populations, or at least know what populations we're addressing or not addressing, can be really important. So we actually sometimes put it in our need criteria if we're talking about real process-based things. So this was really early on. For an example, with Emmy, the birth control app and hardware, we wanted to make sure that everybody had something that was accessible. And you're talking about a lot of things that are considered direct to consumer. So if you're talking about the consumer paying for it, then it becomes a little bit more challenging. But if you can show the impact, if it's the system and the healthcare system paying for it, then that's different. So we have to separate those two. When we went to Emmy, we actually said, okay, we know apps don't work that well, and we need this hardware attached. Let's, for the very first thing, we have to build this app anyhow. We'll charge for the hardware and we won't charge for the app. And so we'll make that universally acceptable to everyone. And it's better than nothing. And we think it's better than the apps that are out there, but it's probably not as good as what we have. Now, I don't like that, building products that are not as good for other populations. But that was our first step. And then always with the eye of saying, okay, now we can get it covered by insurance. We will move in that direction, not just because it's good for the business, but because it's good for humanity. And that's what we actually want to make sure that we're doing. So thinking about those things really early on and often, even before you've built a product. And the one other thing I'll say is sometimes when we think about, well, let's engineer it and then figure out the cogs, you certainly have to do that. But even before you engineer something, remember the simplest solution that actually meets the need always wins. So don't over tech it, don't over design it, don't overdo it. Try to keep it as simple as possible while also still meeting your need, meeting your end goals, and those types.
And continuing that on, like, how do you kind of work with the kind of your patient populations? How do you engage with them? How do you kind of are they part of the innovation process, of the development process? Let's start with Aura first. Like, how are the mothers, your kind of patients, part of your development?
Well, this is also originated in biodesign program. So it's very much, they are very much at the core and the very focus of it. So Annika started off by in an immersion period in the maternity and child health clinics, which account for about 99 point something% of all pregnant women, and then also where I used to work at the biggest birth unit in Helsinki. So very much to put it short, like it's the need comes from them, and that there needs to be something. And also what we did during the process of what we're doing now is that our team interviewed about 30 professionals globally, and the message from them was that there are no people. So healthcare professionals, especially therapists, there are scarce everywhere. So we need scalable solutions, and we need to sort of emphasize that important human interaction and give as much value to that as possible by taking off some load that can be digitalized. We're not saying that everything can be digitalized, but we can take some of the burden and the load off.
Yeah, in the EMAN project, we engaged women with gestation a bit at various stages by interviewing them and with different kind of questionnaires on usability and motivation. And we were happy. We were like able to do iterations with this classical user-centered design cycle with the women with gestational diabetes. So it's a very important part to make this success.
Although I was in the biodesign project, our focus wasn't really. It was a patient-centric, but it was also technology-centric. So we found out that there is this thermal photodynamic effect, which is quite unique antibacterial method. And then we had different conditions we could treat with this solution, ranging from wound care to oral care, etc. And then actually the focus where we wanted to target the oral care was through systemic health effect and how common the oral diseases are at the moment. So it was more like in a market perspective and the global needs perspective. We felt that this is something we want to make a big impact on.
And Janine, can you elaborate on like how do you work with your patient groups?
Sure. It is the fundamental part of everything we do. We can't possibly be able to deliver solutions to patients if we're not involving them from the very beginning. Like was previously mentioned, obviously it's the observation straight from the front, but also then thinking through, we've had many focus groups to understand the need and then vet the potential prototypes and technologies, and they've directed us in a variety of ways. I have so many stories about how they've completely changed what our solution would be, giving us insights that we never would have been able to experience ourselves, and really help direct a development right from the beginning and right from understanding the need. Sometimes my fellows are always, initially in the beginning of the year, especially the physicians are guilty of this. And I'm allowed to say that because I'm a physician, I guess. But they always want to make things to improve the physician's workflow, lifestyle, experience. And those things always end up falling to the bottom of the pile and fall flat, because unless they also and primarily in the US specifically, nobody really cares about what the physician's experience is. We care about what the patient impact is and what the patient outcomes are. So, and that's where it should be. We should care a little bit more about physicians than we do in the US, but I still think that's in the right spot. So think about innovating for that patient from the very beginning and you won't go wrong.
Okay, thank you. And I think I have one more question, then we can open the floor for one or two questions from the audience. So this was already asked today from another panel, but I thought that I can take the same question and spin it for you as well. So how do you see your work in the future, let's say 5-10 years from now? How do you see kind of new technologies like artificial intelligence and different kind of like digital tools, how they are kind of impact not only the solutions, but the way you work and the way you innovate? Do you see there's an impact with this kind of like a new things that we are seeing at the market and developing fast. Yeah.
Well, I think the self-care will increase with the aid of AI. That will be definitely the case. There are many drivers: lack of healthcare personnel, lack of money. All these go to drive the development to the same direction. Increase self-care and maybe remote care or remote monitoring as well. Regarding our work, I think that challenges might become more difficult actually in the future, because there will be the tools will be better, but the problems will be more complicated.
I'm hoping that physicians will become less, how would I say, change resistant. I think, well, yeah, I can say that because I'm a physician myself, but I feel that it's these self-monitoring tools are, I think, the least accepted by the physicians, and they are adopted by the patients. They improve the patients' lives, and then when 20 years ago when the patients came in with their step counts or whatever, and doctors went like, what is that, and don't show me that kind of thing, and it's, I think there will be a huge improvement there, and I think it will be very different profession to practice as a physician in 10 years. I hope it will be very different, and I'm sure the self-care, the preventative care, and the more personalized care will be there. That's I think a safe thing to say now.
What about Janine? What do you think, where are we going to be in the future? What is your thoughts on this?
Yeah, I completely agree. I mean, I think that all change is good change, and we need to change as a field in general. We need to get up to the standard of where, dropping your dog off at doggy daycare is. I mean, like, they know more about their dog and what's going on during that day than and your child in surgery or your child in the hospital or scheduling. I mean, there's so many different things that need to change, but fundamentally humans are still a part of and the core of the healthcare system. So while that may accelerate some of our workflow, sometimes we find it complicates our workflow. Certainly like medical records, especially in the US, have done, and make things worse in a variety of ways while also making some things better. I think we have to be really mindful that these may accelerate our technologies, these may accelerate our advancements, but also there still has to be a human in the middle of it. And we have to be able to double check things, make sure that they're, frankly, in a lot of these AI algorithms, there's very few that have children involved. So you're actually not understanding what's going on with children. And so our advocacy is going to be even more important in those ways. Again, can talk about this for a very long time. I really do hope it's a better world, but we need to be active participants to make that happen. In terms of actually finding needs and vetting needs and doing that, there's this new technology called Sleuths AI that actually takes the biodesign process with the former fellow. I don't know if you guys have heard about it. We have early access to it, but it'll be coming out. But it actually helps you create need statements and vet them, and pretty interesting. It's great, and our fellows are using it, but we find that you also need to understand the process too, to be able to help work with it. And I think that's the part where we can't miss. You still need to understand things at a fundamental level.
Thank you so much. And I think we have a room for one audience question. Then we have to announce who is going to win the pitching competition. So
very
Patrick.
good. So thank you, distinguished panel. So let's have one question from the audience, please. You have a fantastic opportunity here. Someone has to ask a question. You can't go until you do. Yes, come on. Let's have a question.
Riachi, I have a question. Yeah.
Well volunteered.
Well, question, or rather a comment. Okay, so now we are suffering from the decline in our population, and the birth rate is critically going down. Yeah, but still, people focus on helping older people, and I totally agree with what you guys told us. and we need to focus on the human race to survive. We need children, and like the support, and we have a lot of technology and all these stuff, to estimate what's going to happen, and of course, to have a need in raising children and giving birth to children, technology needs to be focused on this side. And yeah, I'm grateful to what you guys just presented. But the question is, okay, who's going to support this? Where does the money come from? Who would like to pay? And this is a question, and we all need to think about. Thank you.
Thank you. Panel.
So Janine, did you hear the question?
I couldn't hear it very
Okay,
well.
so I will just repeat
if
it.
you
So
can
basically,
repeat.
the question is that as there is kind of declining birth rates, there's still emphasis on like providing solutions for more towards, let's say, elder care, and maybe not enough emphasis on like young families and like raising children and like supporting this kind of aspects. So what do you have any thoughts on this? What could be done to like different support or like systems that could like have an influence on this topic?
I mean, from what I understand about the Finnish system, I think you guys need to answer that, because we clearly have done a terrible job supporting families, children, mothers. We don't have paid maternity leave. We don't have mandatory paternity leave. We have extreme childcare costs. It is creating smaller families, people working from home. We also have extreme housing costs, unhappier populations, and everything I hear from your country, which I would love to visit someday, is that, there's a rosier picture there. Of course, I'm sure that everything is, with rose-colored glasses from afar, but we have structural problems, like I mentioned before, in the US that really impede our ability to ever have incentives that focus on children, because we care about the people who vote. And there's a big election coming up, and it matters who vote, and they listen to the people who vote, and that's who has a voice in our country. And so it's up to the rest of us to have a voice for the people who don't. But there's things that need to change, and there's things that really need to change if we're going to survive as a society. We obviously have to invest in the future and not the last few months of life. It makes absolutely no sense. But it's seen over and over again in our own population, our own decisions, and the structure. So that's why we're working from a policy aspect, from a very fundamental aspect, to change policies within the US to be able to promote a higher birth rate and more support when those children are born. So you guys know how to do it. We don't.
This is a really big political question, and I hope the wisdom for the politicians to make the right decisions. And I actually need to go to get my children out of daycare now, so I need to finish.
So you are putting the primacy to the children. That's
so
good.
We'll let him go, and I'll stay. And so I love the question, and I love that we're putting emphasis on that one, because it's exactly the question that we are asking. It was shown here in a PhD thesis defended about a year ago here in the Helsinki University that a bad birth experience actually decreases the likelihood to have a second child by 25%. So that is at least our contribution. We can improve the childbirth experience, and through that improve the number of children in the family. But luckily, the reducing birth rate is pretty much the problem of the Western world. So maybe the balance is shifting, and kids are still born elsewhere. And this is going back to what you just said, Janine, that we've been trying to do quite a bit in terms of doing those social interventions and putting families in the front. We're not doing that great on improving the already very good maternity care. I must say that it's globally it's rather good, but it's something that is happening that is probably beyond what we can do as medicine, as sort of healthcare. It's a global, it's a cultural change. It's a change in the values and fundamental fundamental things which are beyond our hands, I think. With the mobile application, I won't be able to save this problem.
Yeah, but with the citizens and like we can have maybe some work together.
Yeah, for sure. I can do a tiny bit.
Good. I think that's a very empowering note to end upon. So it's not just about the company, it's not just about the technology, but us, like thinking about how to make this shift happen. To put more emphasis on like families and young children, to keep them like healthy and like giving them a promising future to look forward to. So thanks all for the panel.
Thank you.
Thank you for the opportunity.